Inside Healthcare, we begin by talking about Minnesota's record number of air quality alerts this season, and also some of important new Minnesota environmental reforms and investments to combat climate change here in our state. And we are honored to have with us Senator Nicole Mitchell, and she's a meteorologist, and she is also with the Air Force veteran and state senator serving in the Minnesota Senate. So really a pleasure to have you with us. And first of all, thank you for your service.
Oh,
you do.
Thank you for having me. It's an honor to be here and to help our state in so many ways.
Yeah, and there's so much right now when we're talking about the weather and the climate and stuff. So as a meteorologist, your thoughts and comments about these record number of air quality alerts that we've seen here in Minnesota. What do you think about?
Unfortunately, I think we're going to be seeing more of that as we go into the future, because if you just remember 2 years ago, we also had fires in Canada and even in the Arrowhead. And when the wind is just right, it brings that smoke in. So 2 years ago, we had a number of records, had set the worst air quality record one day, and then just a few days later, we reset it at an even higher level. This year has been really unprecedented. There was a point where we had the worst air quality in the country.
Oh, that was terrible. Yeah,
yes.
We don't want to make national headlines that way.
Yeah, no, you don't. And that's an unfortunate side effect of climate change, is when we get hot so early in the summer season, we start to head into drought right away. And so we're having another very dry summer, and this is kind of turning into a pattern for us, and then that exacerbates the fires, and then we have the smoke.
Wow. So what advice or tips do you have for people to stay safe if we have, as you said, most likely have some more of these, these record air quality alerts and things like that?
I mean, you really just need to stay in when it's that bad. I have small kids, and for example, if they're playing a sport, their lungs are developing, they're taking deep breaths. So if they're playing something like soccer, you don't want all that particulate in your lungs in that way, and for any sensitive group especially. But yeah, if you can stay in on those really bad days, and then long term, we need to seriously address climate, not just the things that we'll do now that will help down the road, but improving our water and our air now, so that when we do have these days, maybe they're not as bad if we're not also contributing on the pollution side.
Absolutely. Some of those other concerns that you must have for these extreme weather conditions and stuff, and other things that maybe we as families can be doing to protect ourselves.
Well, so our weather is changing as the climate changes. If you, again, think back to 2 years ago, for the first time ever in Minnesota, we had a tornado in December, the latest we've ever had it. So we need to be more aware of the weather, because we're going to start having more of these extremes. When we do get rain in the summer, it'll be drier overall, but a hot atmosphere can hold more moisture. So then we talk about the potential for flood, which seems like a contradiction, that we can be in a drought, but when we have rain, it could cause flooding. Yeah. But that is one of those scenarios. So we need to be more prepared overall. And again, this is a good reason why we want to think long term. If you're a farmer, that might impact what crops you plant or how you manage, and just in our own homes, thinking about the impacts to us locally.
I think locally we were hearing about the strawberry crop and pineapple orchard. Like they had to close it early this year.
Yeah, it's
unfortunate. I think they said for the first time, I think they had said so. So talking about long term, in the state legislature, major activity, I should say, a lot of things having to do with environment and the energy and climate, and you are also on the committee that has a lot to do with that. So as I said, there was a lot. Maybe you can kind of talk about some of the most significant things that were decided and approved and stuff like that.
I mean, because it was an amazing list, I could be here for the whole show just talking about some of the things that got done. So I think clean energy, really making that commitment that by 2040 we were going to try and be carbon neutral as a state is amazing that we were able to do that. There were a lot of initiatives. I carried some of them for electric vehicles, making sure we have more charging stations around the state, and more investments so that they're more affordable for everyone if people want to go that route. A lot of solar expansion, whether it be on schools or people
Public
being able,
buildings?
yep, public buildings, people to be able to do it in their own homes, and also looking at our grid, right? So that if people are adding more of that in, we have the capability to manage some of that energy as we provide it. So a lot of amazing things that got done.
And there was some incentives and rebates and grants in some of those areas as well?
Yes, so for schools, just as one example, there was a large investment both in being able to put solar panels on the schools, but also more communities being able to get electric buses so the kids don't have to sit, especially if the bus is idling, with that diesel smoke around them, so that they can have a cleaner environment.
And then some of the other things when you were talking about the other renewable sources with the solar and wind and things like that, other things that are on the horizon that we're looking at for schools and for buildings in addition to that?
Yes, so again, just being able to have more green spaces for everyone to enjoy. The solar initiative will be great. Some of the community solar gardens, so that if someone can't do it in their own home, they can maybe invest in one of those. The rebates for, again, people to be able to put them on their own homes will be nice, and that will stay in place. Because we don't just want a certain segment of the population to be able to get involved. So if we can make energy efficient appliances, solar panels, electric vehicles more accessible to any income bracket, I think it enables people to feel more invested in the environment around them.
Another thing that was discussed was the forever chemicals, the PFAS and stuff, making national news. I think I read they were saying, a new government study saying how rivers are everywhere in the country have these forever chemicals in them. And what are some of the things that we're looking at here in Minnesota to reduce
So
that?
I live in Woodbury, and that's been something we've really struggled with in our community, having a number of our water towers go down because they haven't met the standards. So there was both investments in water treatment facilities at different parts of the state to make sure people currently have clean water, and then the PFAS legislation itself, because one of the concerns is a potential link to cancer. And so, we don't want that happening to our water. So PFAS is in some of the firefighting foam, so making sure that for training purposes,
Absolutely.
that's not being used. Still having the tools we need for actual fires, but we don't need to be using some of these things all the time. Taking them out of some packaging and some different products that they don't necessarily need to be in. Just other ways, and I know that 3M, separate from the state legislator, has made a commitment within the next couple years to quit making products with PFAS. So that overall commitment will help our water for future generations.
It feels like Minnesota's at the forefront of all of that.
We're
leading
trying to
that.
be.
Yes, absolutely. Another thing that the state lawmakers, and including yourself, worked on investing more in some of our natural resources. What are some of those things, and what are those areas that you're looking at?
So some things that I think were really creative. For example, there's some of the buffer areas by highways, putting in these like pollinator areas and kind of putting in a land buffer so that we can help
For
our
the
pollinators.
biodiversity, yeah.
Yes. We're also investing more in our state parks, making sure that those great places for people to go are out there. And also just some rules for cities that if people want to have a pollinator garden or something else, relaxing it a little bit, so to speak, so that people can kind of do some of those things in their own yards.
Well, it's amazing all of the work that you've been able to do so far. Any other comments that you'd want to talk to our viewers about the biodiversity, what they can maybe do in their home or in their neighborhood or in their communities?
Right, so any little bit helps. Obviously, hopefully keep electing people who have a long-term plan for what we can do. But, in my family, we compost, we try and recycle. Just those little things really help the environment. I was way behind in my garden because we were so busy with the legislative session.
Oh my gosh.
But I found
can't believe we got anything done.
I found some, it's still kind of messy. I found some natural milkweed that was growing, and I just left it. You know, I worked around it, and now we have monarch butterflies, and we've even raised a couple.
I love that.
Even just conserving water, especially as we talk about those drought things, and just being mindful of the resources you use, all of those things can really make a big difference.
Any final comments or where people can get more information?
If you have any specific questions, you can always contact my office. Even in the off session, we have meetings. There's also some great, so many projects came from different places. So some are, you know, the DNR, the Minnesota Pollution Control Agency. It kind of depends on what the topic is. And then there's great groups out there like Clean Energy that are kind of helping lead the way on renewables. So yes, if you want more information on a specific topic, get a hold of my office or look up maybe one of those great groups.
Well, it really has been a pleasure to have you on Inside Healthcare. We really appreciate it, and valuable time too. You were saying you're with the Lieutenant Colonel with the Air
Yes,
National
I'm about
Guard.
to leave for
You have to
weekend
go.
duty.
So taking time to be with us, we really appreciate that.
Absolutely.
Thank you. Thank you. Well, up next, we talk with a nurse practitioner about medical cannabis and how it can help you with various health conditions. So stay with us.
This little heart valve did something really big. It saved my life. I wouldn't be here today without it. The research for this heart valve was funded by the American Heart Association. To learn more about the American Heart Association, go to helpheart.org today.
Welcome back to Inside Healthcare. Minnesota just legalized recreational marijuana, which starts in August, and medical cannabis has been legal here for several years. To talk about medical cannabis and how it can help treat various health conditions, we are very pleased to have with us Jacqueline Higgins, and she's a nurse practitioner and a cannabis consultant. So really a pleasure to have you with us.
Thank you, thank you.
Again, tell us a little bit about how you got, what you do and how you do it, and how did you get started in this?
So I've been a nurse practitioner since 1999, and I've had many roles and practiced in many areas of medicine. And eventually I made my way to pain management, where I focused in chronic pain. And during that time is when I started being exposed to cannabis as medicine. So 2014 came around, and medical cannabis became legal, with chronic intractable pain being one of the qualifying conditions. In order to engage in the program, you need to be qualified that you do have a condition that meets the criteria. And so it was during that time that I got curious, because I hadn't worked with cannabis before. I didn't know anything about it. I have to admit, I was very apprehensive. I didn't want to harm anybody. And so I started really on a journey to study and to understand what this was, because I had colleagues who were very supportive, and they started qualifying patients. I started seeing how patients were doing, and they were doing well, and medications were being reduced or discontinued. I certainly not for everybody, but there were definitely a significant group. I started seeing people go back to work, and once you start seeing things like that, you're just curious, like, what is this and how does this work? I made my way to Pacific College, where I ended up getting a certificate in medical cannabis, and I am currently enrolled in a Master of Medical Cannabis Therapeutics program, about halfway through, with a goal of really being a support system for the medical community. The medical community could use that a little bit, especially around the area of medical cannabis. Yeah.
And I think some of our viewers may be wondering exactly what is medical cannabis, like confused about it as well. So
Sure.
What exactly is that?
So I would say that medical cannabis targets particular health conditions, and a lot of times what you hear is people talk about a qualifying condition, and that is a disease or something where a person may benefit from the implementation of cannabis. It is medical professional directed, and so you are communicating with your medical professional about how things are going. There's kind of a whole process to get registered for a medical cannabis, qualification, and then to enroll within the program. Once somebody's enrolled within the program, they meet with a pharmacist who is at the dispensary, who then helps them identify tools that would be most successful or are expected to be most successful. And then they periodically check in with the professional who qualified them, or sometimes people will talk to other professionals, about this is what's happening, and is this okay, and is this normal, or how do I make this work better, or I'm noticing this side effect, or I'm just not sure I understand this is what I want to work with, or I'm doing great and I don't feel like I need to do this anymore. And so you have these opportunities to maybe unwind different medications, or I think there's just some unique differences to when you're working with a cannabis treatment as a medicine versus an adult use format.
And it comes in different forms in that?
There's different forms. So you would base forms on the goals of treatment because you're thinking about the onset of action. So if somebody is living with chronic pain, you might really need something for breakthrough pain, and that might be an inhalation format because it would onset within about 5 minutes.
Interesting.
But they also might need something that's more round the clock. And so in that setting, you might want to go to a pill form or a tincture form where you would expect that an oral route of delivery would have a slower onset of action, and then the duration would be longer.
I know I interviewed a Minnesota firefighter who had severe PTSD, and he said that the only thing that could help relieve his anxiety and his depression was medical marijuana. What are some of the other conditions that benefit from the medical cannabis?
So there are 19 qualifying conditions in the state of Minnesota. In fact, 2 were added this year. There are several strategies on how those are added. Usually there are petitions that would be submitted to the state. And certainly the diagnoses that were included this year are irritable bowel syndrome and obsessive compulsive disorder. But Alzheimer's is on there, and sickle cell is on there, and chronic pain is on there. There are many conditions, and they're available on the website, so you can kind of scoot in there and peek and see if you have a condition that might be appropriate for qualifying.
In dealing with your patients and clients, what have you witnessed and experienced with them with the treatment?
I've experienced several things, some good, some could use a little improvement. I would say that there has been a little bit of a cumbersome getting into the program, but once in the program, I feel like patients are very well supported. There are some expenses that have been addressed, I think, with this latest law that will be beneficial for patients. But in general, the things I have observed is that people were doing better. They were reducing medications. Opiates are certainly a medication a lot of people are concerned about. Could everybody get rid of opiates? No. Some people really just were struggling in that direction, and the pain was significant. And cannabis actually blends with opiates okay, so it's not like that's going to cause them significant or severe harm. But the reduction in the opiates certainly was supportive. Some people are able to reduce the muscle relaxers, and so we were seeing really some wonderful changes in medication profiles. The other thing that I was personally seeing is that it didn't seem like it was so difficult to get to the grocery store. And I could sit through the dance recital. And I wasn't worried about the graduation. And I was really excited to go to the wedding.
Oh.
And I took a family vacation.
That's got to be rewarding.
So those are really beautiful things. And people who went back to work after being on disability, there were things I saw that I couldn't unsee. And so that's why I've really been curious about this as a medicine and as a treatment.
And not to be confused with the recreational marijuana that has just been legalized here. This is for medical purposes.
Right, I'm speaking to the medical focus in this setting, yes, correct.
And do we know how it actually works?
So we have this really cool body system that we found out about in like the 1990s called the endocannabinoid system. And cannabis works on the endocannabinoid system. We have our own inherent endocannabinoids. One of them is AEA, known as anandamide, and there's a little kind of joke that goes about that because it means bliss in Sanskrit, and so it kind of gives you an idea of its actions. And then the other is 2-arachidonylglycerol, or 2-AG, and that they just work kind of throughout the body. Typically, people would associate AEA with brain and 2-AG with more like immune and body, but those are pretty gross generalizations. But they work, and it kind of gives people an idea.
Well, you've got to feel satisfied that you're able to help people
Yes.
in this
Yes.
way. Final comment for our viewers. Medical cannabis.
Yeah, on medical we've had 80 years of prohibition, and during that time you kind of lose some information and skills, and I see the medical community as being really having some curiosity at this point, a little apprehension, but definitely some curiosity about how do I talk to people, how do I work this into my practice, how do I do this? So if we could all give each other grace. If a patient brings it up, give them grace. If a professional is not sure about it, give them grace. So let's just embrace that we're all kind of relearning after kind of 80 years of prohibition, and it's kind of still a Schedule 1. So if we could do that, that would be wonderful.
A pleasure to have you on the show.
Thank you.
Thank you, Jacqueline. Really appreciate it.
Thank you.
And up next, we talk with the local doctor about what you should know about Lyme disease. So stay with us.
Get it, slip it, cuff it, check it. Talk to doctor now and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Finally, state health officials say Lyme disease is on the rise in Minnesota. We talked with Dr. Kristi Trussell with the urgency room about the symptoms and treatments of Lyme disease and what you can do to reduce your risk of getting it this summer. Here is Dr. Trussell. Dr. Kristi Trussell, always glad to have you on Inside Healthcare. And I know that the health department is saying that the Lyme disease has become endemic throughout most of Minnesota, even like the central, western, eastern part of our state, and with Lyme disease, and it's affecting thousands of residents each year. So how do you know, what are some of the common symptoms and signs of Lyme disease?
Well, first of all, I think we start with talking about Lyme disease comes from deer ticks. So first thing you need is deer tick exposure, and not just exposure, a deer tick that attaches, stays attached, feeds, becomes engorged, and is on there long enough to transmit the infection. So Lyme disease is a tick-borne illness, which means the first thing is the tick bite. Not everyone knows they had a tick bite, but that's the first part of the infection. Following the tick bite, it can be anywhere from 3 days to a month where you'd have just general flu-like symptoms. So and not everybody's the same, but fever, body aches, malaise. Sometimes people get swollen lymph nodes. Later in the illness, you can get joint trouble and heart trouble. A good number of people do develop the very characteristic erythema migrans rash, which is a target type rash that has this kind of particular pattern and particular red appearance to it. It doesn't always follow the rules and happen right at the spot where you got your tick bite. And it can look different on different people's bodies, different skin tones. So it's not that it's always the exact target rash that you might see if you looked at it on the internet, but a lot of people do develop a fairly characteristic rash after the tick bite. If you see new rash, particularly if it's somewhat like a target after you've been out in the woods or grassy areas, that's something to see. That's something to see a medical professional for. to have a look and decide if you need treatment for Lyme disease.
I know one of my friends, she was saying the same thing, that she just thought she just had the flu, and she went in to get tested and found out that she did have Lyme disease. She didn't remember having a rash or anything like that. So how do you go about diagnosing Lyme disease at the emergency room?
Well, we do see a lot of people for tick bites in and of themselves. So sometimes patients come in with the tick still attached, and we can assist with removal. We can assist with identifying if it is truly a deer tick, the type that spreads Lyme disease, as well as other tick-borne infections. Wood ticks, which are bigger, sometimes folks come and see us for those too to help them get those off, but those aren't dangerous in the same way because they don't spread Lyme disease or these other more common tick-borne infections. So we can help with tick removal for patients for whom the tick is engorged. We think it's been on for a significant amount of time and there's significant risk of transmission of Lyme disease. Then there is the option to get an antibiotic to prevent Lyme disease, or what we call prophylaxis, which is really a single dose of antibiotic can be really effective at preventing any subsequent Lyme infection. So that's one thing that we do at the emergency room. Certainly we evaluate people for symptoms after their exposure. We see folks for the rash, and if you see the erythema migrans rash, then that is considered diagnostic of Lyme disease. You don't need any further testing. Testing for Lyme disease can actually be a little bit tricky because it's an antibody test, and then there's some other steps that follow after that. And we won't get into the nitty gritty of Lyme disease testing here, but there is a blood test for Lyme disease. Sometimes it can be a little bit tricky to figure that test out depending on prior exposure, prior infection, timing of infection. But if you have tick bite or known high risk exposure, rash, symptoms, the clinician would take that into account in making a decision on either treating empirically, which means based on symptoms and exposure, versus doing further testing if the picture is a little bit more unclear.
I was going to ask about treatment then once it is diagnosed, one way or the other. Yeah, how do they go about treatment?
The most common treatment for Lyme disease is doxycycline. It's a longer course of antibiotic, typically 2 to 3 weeks. There are other antibiotics that can be used based on age, pregnancy status, allergies, other intolerances, and other considerations. But doxycycline is considered the first line choice antibiotic for Lyme disease.
And back to the advice on preventing it, try to avoid some of those areas where ticks more likely would be available in the tall grass and things like that, or?
Yeah, so prevention for Lyme disease is really kind of your good outdoor preventative strategy. So wearing lawn sleeves, lawn pants, covering the openings in your clothes, for example, pulling your socks over your pants. If you're out in a wooded or grassy area, making sure that you check your skin for completely for ticks. Again, the ticks really need to be attached for a few days to transmit infection. So simply having a tick on you doesn't necessarily mean you've been exposed to Lyme disease.
That's good to know.
Getting those ticks off in a timely manner and making sure they don't have time to feed, become engorged, and that's when they actually spread the infection is a really important part of prevention. If you do find a tick that you think has been on there for some time, then contacting your healthcare provider to discuss either prophylaxis or treatment, depending on timing, symptoms, and other factors.
A pleasure to have you, as always, on Inside Healthcare. Thank you.
Thank you so much.
That's our program for you. Thanks for joining us on Inside Healthcare. We'll see you again next month.